Today, discussion will be red eye, so ophthalmology lecture. Because we learn general internal medicine, everybody must know eye. Surgeon, internist, emergency room, everybody must understand basic. Plus, most important, your friend and family who is not doctor, they will ask you, please tell me about red eye, how do I take care of? So this is basic 45-minute discussion. Mostly we will do picture, so mostly picture of red eye. So maybe you will make notes. Mostly picture of which thing makes red eye inflammation. Let me do just brief anatomy. So eye anatomy is difficult. I forget every time, so I always check up to date, check internet. But when patient has eye redness, if eye is red, important distinction is front part of eye. Posterior eye does not cause red eye. Only anterior part of eye causes red eye problem. So you don't know not this anatomy, no. It's this anatomy. You must remember 4 or 5 anatomy parts. This is cornea. The front of eye is called cornea. Then this is makes a pupil. Is an iris. Then inside the light comes through lens, and then this is ciliary body. So it is very important, just 4 or 5 parts of the eye. I don't know Japanese terms. Dr. Ono, maybe is the Japanese term the same or different? I don't know if it's different. Same. Same, okay, right. So everybody knows? I can use the word, it's okay? Yes. Okay. So just remember anatomy because we will talk about cornea problem, iris problem. When we say iritis or uveitis, this inflammation here. If we say cornea problem or conjunctivitis, is outside here. Okay. So before we do a differential diagnosis, or before we have a discussion about red eye, please tell me some causes of red eye. Which is etiology or causes of patient having red eye? Give me some idea. Somebody will tell me cause of red eye, otherwise I will ask a question. One differential diagnosis, red eye. Dr. Kikuchi. Dr. Kikuchi. One etiology of red eye. How come patient may have red eye? Infection. Which type of infection? Which virus infection? Most common is virus infection. So we must always remember virus. And the red eye is conjunctivitis. Yeah, we'll use board 1 minute. So conjunctiva inflammation can be, if it's infection, virus is number 1. Also bacteria, allergy, and some irritation. Maybe chemical, maybe smoke, some irritation. So first differential diagnosis is inflammation around the eye. So conjunctivitis, so this first idea. Second one, somebody else, please tell me another differential diagnosis for red eye. Another possibility. Another differential diagnosis. Perhaps you can tell me another cause of red eye. Which is other reason. What's that? Injury. Yeah, it's actually a very important cause that patient has trauma. Maybe they are in a bar fight and somebody punched in the eye. Maybe they are at Wimbledon, if you are watching Wimbledon, and a tennis ball hits in the eye. But trauma can happen also, so you must remember trauma as possibility as well. Very good. One more. Dr. Kanoki? Another cause of red eye. Why else? What if a patient has rheumatologic condition? How come they may have red eye? Okay, no problem. You can ask friend. If a patient has rheumatology problem, how come they may have red eye? If you're in rheumatology clinic, patient has red eye, usually not conjunctivitis, usually not trauma. Which part of the eye becomes inflamed? You can take guess, only 3 parts of the eye is Any idea? Any other idea? Maybe you will make one guess? Glaucoma, yeah, glaucoma is not a rheumatology question, but absolutely, if a patient has glaucoma, it's important they have acute glaucoma. So it's acute, not chronic. And I will give you other answer just so we can do pictures, because the best way to learn is by picture. If patient has rheumatologic condition, most common etiology is iris inflammation. So we say iritis. Iritis, or another name, uveitis. I will show you pictures. So there's many lists. You can look on iPhone, you can look up to date. There's long lists of causes of red eye. But we must know just basic idea. Maybe it's problem with conjunctiva, front of the eye, problem with iris, problem with anterior chambers, glaucoma, trauma, and 1 or 2 other that we will see in the picture. I will put this back. Usa, can we decrease lights? Right. And now we'll do pictures. So just reminder again, either problem is anterior chamber, cornea, or conjunctiva, front of eye, iris, or ciliary body. Eye is confusing, but remember 3 or 4 parts. Okay. So this is most common, most typical cause of red eye is conjunctivitis. So we mentioned most common. If you are in clinic, 80%, 90% of patient has this. But you must know differential diagnosis, because maybe it's virus, most common. Maybe it's some irritation in the chemicals or smoke. Maybe it's allergy. If patient has allergy conjunctivitis, which other complaint will they have? They say my eye is itching. But which other complaint will patient have if allergy is bothering them? Which other system they have complaint with? Any idea? Maybe you can make one guess. If patient has allergy, they have itchy eye, but which other problem do they have?
かゆみって何ですか？
かゆみ以外に何があるか。
かゆみ以外で
どこか。
どこに？
他に。
You have translation. So where's your machine? Where's the machine? The translating machine. Wait, which nose is bothering, lung? Which other symptom they complain if it's allergy?
Can somebody translate that?
Yeah, they have that. Maybe usually if they have eye problem like this, and it's allergy, also nasal discharge, coughing, sneezing, some other symptom. So you must ask questions. It's not only eye question. You ask nose question, pulmonary question, other questions to say if this is a problem. Now, how do we know if patient has bacterial conjunctivitis? It's not too common, but it's important. How do we know what physical exam feature or history feature tells doctor conjunctivitis but bacterial? Which one must we ask? Which thing will patient tell us? Does anybody know? Dr. Ishikawa, do you have some idea how doctor may know that it's bacterial more than conjunctivitis? Which feature? I will show you picture in 1 minute, but I'll show picture now. Maybe then you can some guess. How do we know it's bacterial? It's difficult. A few observations. One is some redness is more severe. So not light pink, but very severe, very red. Also, patient has some mucus discharge. You see white. This is a separate patient. They have white discharge inside eye, and sometimes white discharge on eyelash. So maybe more pain, more redness, but also thick discharge on eyes, and discharges all day long. So many conjunctivitis patients wake up in the morning a little bit of discharge, but bacterial conjunctivitis is all day long discharge. So two things: more red, more discharge is how we make a diagnosis. Okay. This is separate. Has anybody ever done this in clinic? This is, I don't know the Japanese word, maybe someone can translate. This is a fluorescein stain. What does Japanese word say? No, same. Same, oh good. Is fluorescein stain. Patient comes in, patient history feels like something in my eye. Maybe he was walking on beach on a windy day, and he went Chigasaki Beach. He's by the big sea, South Beach Sea. It was very, very windy, very windy. The next day he comes to clinic saying, something in my eye. What is diagnosis here for this patient? What is diagnosis for him? Do you have idea? A dry eye, but there's problem. Dry eye means eye is okay, just no tear. Here there's some problem because abnormality arrow. So there's more than dry eye. Which problem? What happened in the beach? Sand. So sand come in the eye. What did it do? What did sand do? Not allergic, because allergic is coughing, sneezing, running, but maybe it did some damage, some irritation. So another I'll put here on board, but this is typical history and appearance of cornea abrasion, or cornea minor damage. So minor damage for this. We say corneal, I'll write here, abrasion. Because patient had just the fluorescein is chemical, and chemical goes where there is small damage, small bit of damage. Most important, what is treatment? Can he go back to the beach tomorrow? Does he have to stay home? What is treatment if patient has cornea abrasion, small damage? Do you know? Treatment, how we do treatment. I do it. The translation, what did she say?
Yeah.
What's that? English translation? Can I get somebody?
Yeah, I didn't know. She's saying some kind of eye drops.
Yeah, you can just do simple eye drop. Don't need an antibiotic, but just simple eye drop, like saline eye drop. Just keep eye protection. In a few days, it will heal. So it's only just simple eye drop, you know. Some doctors, some ophthalmologists give antibiotic, but it's 50-50, so. But just simple eye drop like saline, maybe if you want antibiotic, some doctor yes, some doctor no. But it will heal itself. So you don't need ophthalmologist. Primary care doctor, GP can do, no problem. It's very simple. Okay, would like to get this is okay. This is one we mentioned before. It came in differential of red eye. If you were watching Wimbledon yesterday, and patient, great tennis player has eyeball, the tennis ball hits in the head, and then they see doctor. 1 hour later, they have this abnormality. Please, what is the abnormality the patient has? What is the problem in their eye? It's a trauma. Could be also after a bar fight, if you have, or maybe a bicycle accident. But if you have trauma near eye, what is abnormality in this eye? which is abnormal on physical exam. Because this one is emergency, so we have to learn to recognize. Dr. Togawa? Which is, just look at what part is most abnormal? Keep thinking. Is normal eye or abnormal eye? Abnormal. Okay, good. It's abnormal eye. Good. Beyond one. Okay. Number 2, conjunctiva is red, right? Because we're doing red eye lecture. So conjunctiva is red. But which other part has redness? Which other part of eye has abnormality? You can get translation. What's that? And yes, exactly. And what do you think this is? This is anterior chamber. What is inside anterior chamber? You have helper, very smart helper.
Bleeding.
Yes, bleeding. So it's a simple question, but we must recognize, especially if you work emergency room. I think if you are in an emergency room, you must recognize this. This is blood inside anterior chamber. Usually patient has a history of some trauma. And if we can do lights, I will show you the medical word again. This medical word is hypopion. Is it spelled that right, Joel? Is it hypopion? Is it P-O-N?
I think so.
I think so. The pronunciation is right. Okay. But this is blood inside eyelid. So it's important. Oh no, hyphema. I think I have backwards. So this is next one. Sorry. I gave answer for next one.
Infections.
This if inside the eye, if there's blood, it's hyphema. If pus is hypopion. So I'll show you a picture next one. So we must, even to make diagnosis, name is so-so, you have to remember, but you must recognize it is abnormal, and you must refer to ophthalmologist because it means damage inside the eye, retina problem, iris problem, some tear, some damage occurred from bleeding. So if you can see this hyphema, this is blood, hyphema, then you must use this. Okay. We have to turn lights on and off because last night was resident party, so people are very sleepy. So I turn light on, off. If I keep off, then everybody falls asleep. So lights, we'll turn off. Lights off. Okay. Then next one. This is example of other one, hypopion. Same concept. Yes, redness around eye, conjunctiva, severe inflammation, but anterior chamber has not infection, or sorry, not blood, has white blood cell, has pus. So two differential for this. Most important is infection inside the eye. So most concerning is patient has infection inside the eye. This medical word is endophthalmitis. So it's a long word, but endo means inside eye infection. So maybe patient has eye surgery, maybe patient has eye trauma, maybe patient has bacteremia endocarditis, and enters inside the eye. If it's mild, maybe small amount, let's say little bit of white cells, little bit of red cells, a little bit of erythema. Sometimes patient has iritis, but this is a minor one. This is very, very severe. This is severe case endocarditis, staphylococcus infection inside eye, and pus inside the anterior chamber. So remember the difference between this one, blood inside eye, trauma. white blood cell infection or inflammation inside eye, both you must call ophthalmologist for immediately. So both is emergency. Okay. What is this? I will give you clinical history. Clinical history, patient feels fine, no visual problem, no complaints. He says, I feel okay, but then his wife sees him. Patient's wife sees him. She says, what happened to your eye? Were you in a fight last night? Did you go to bar and you didn't tell me? She wonders, how come he has red eye? This is very common in clinic. You maybe see an emergency room. Dr. Okamura, you are working in emergency room. maybe you will, yesterday he did a very good job. I saw fixing somebody's knee. It's an excellent job. But you fix knee, but you also have to fix eye in emergency room. So, do you know what this we're discussing red eye, problems with eye. Do you know which patient asymptomatic, no complaint, perfect vision, healthy man, how come he has this red eye? Observe. No treatment, no extra treatment. Yes, that's right. The patient has no problem here, so only have to do observation because diagnosis is subconjunctival hemorrhage. May I have light, please? I'll show you. So this one is called subconjunctival hemorrhage. This one is doctor and patient's favorite diagnosis because no problem and he will be better 4 or 5 days. Nothing to do. Just simple observation. Because you see a very nice small area of blood, but rest of conjunctiva healthy, pupil healthy, iris healthy. It's beautiful eye. No, it's very beautiful eye, but small area of blood. So probably one blood vessel, one small blood vessel popped. And it's okay, maybe they cough too much, maybe they sneeze too much, and one blood vessel breaks. But 4 or 5 days, redness will go away, so only observation. Can we shut lights? So you should know, you should look at this eye. You should have memory of this in your brain because maybe your family member says, oh, I have red eye, or maybe your friend calls you, they're not doctor, and they say, come to my apartment, look at my eye. And so you come over, and you can tell them, if you see this, it's okay, don't worry, it'll be fine. So, but important thing is, everything else is very nice color, no problem rest of the eye, only small area here. Okay, so subconjunctival hemorrhage, recognize this one. This one, I'll give you explanation. This is very severe case of acute glaucoma. So, whole world has, glaucoma is very, very common. Glaucoma is problem with optic nerve plus problem with elevated eye pressure, intraocular pressure. It's a combination of both nerve problem and eye pressure problem. It's like hypertension inside the eye. They say eye hypertension. In severe case of glaucoma, I'll show next slide. What happens is this is, remember this is up to date, so you can find this picture on up to date. It's a very nice picture. Usually healthy eye makes aqueous humor. Under this, aqueous humor is fluid. It's fluid inside eye. So makes fluid, comes around, and then goes into venous system. So it's like a river. Very nice, easy, smooth river, works fine. But if this angle closes, if iris comes back, this angle closes, then fluid increases inside of the eye. So let me see if I have this. So then this is a problem that patient has, is fluid is coming, but trapped. cannot leave. If it's acute, it gets this complication. So in emergency room, you must measure pressure of the eye to make diagnosis. But you will see severe edema, severe erythema, but also anterior chamber becomes cloudy. The whole anterior chamber becomes cloudy. Also, this is important, you must do history. Patient has many, it's very interesting problem. Patient has many complaints. Nausea, vomiting, severe headache, feels very, very bad. So other problem, subconjunctival hemorrhage does not have this. This one, patient has many problems. Does not feel well, upset stomach, because some pressure causes vagal nerve problems. So patient will have GI complaint. Sometimes doctor doesn't even notice. Patient comes in, nausea, vomiting, but nobody looks at eye. Maybe patient has sunglasses on or something. The problem is acute angle glaucoma. They say, I have nausea, vomiting, headache. We say, oh, most likely viral syndrome. But maybe problem is acute angle glaucoma. Okay. And then we'll do final, last example here. This is, I won't ask, but maybe if you, this is a nice picture. If you make observation, this patient has light pink inflammation. It seems like conjunctivitis patient. Remember first slide we did was conjunctivitis? It may, but you see most inflammation is near here. Most inflammation, maybe on this screen even better you can see it. Most inflammation just around this. So what is the diagnosis of this patient? It's not conjunctivitis. Swelling is just around the iris. And they have severe photophobia. If you take pen light and you put in their eye, they'd say, no, cannot, too bright. In fact, if you put light in other eye, also the eye, they have eye pain, so they cannot take light. So this plus severe photophobia plus patient has joint pain, young woman with joint pain. What is diagnosis here? Most inflammation, most of the inflammation you will see is around iris only. Around iris. What is diagnosis? Maybe you will try. Do you have idea maybe which is diagnosis? What's that? Yeah, maybe she has SLE. Yes, she has young woman with joint pain. Maybe she has SLE. But what is problem with her eye? What is eye diagnosis for inflammation? SLE patient, inflammation around the eye. It's one of these on the board here. So multiple choice question, like exam. I write this. So this typical feature patient has maybe rheumatologic condition, not all, 50-50, but has maybe some joint pain, but eye has severe pain, moderate pain, but they have photophobia, because if you shine light on eye pupil constricts, but then whole inflamed iris causes pain. So if you give light, pen light here, patient has photophobia, because inflammation is in iris. Whole iris is inflamed, and evidence of inflammation is around, just around iris. So patient has iris inflammation. So I'm going to go backwards so we can review all pictures again one more time. And I'll show you example. Remember, this is number one. Case number one, conjunctivitis, is opposite of iritis. Look here. Here, this patient, oh, sorry. No inflammation here. See? You see? Around white, little bit of normal. When iris is inflamed, red, but when conjunctiva is inflamed, normal white tissue there. Okay, so this is conjunctivitis, allergic, viral, toxic. This is bacterial conjunctivitis, more erythema, and maybe some, maybe some mucus discharge. This one we said is walking on beach in Chigasaki, gets sand in the eye, is cornea abrasion, damage to the cornea. So you see 2 spots there. No treatment, just a little bit of eye drop. This is trauma to the eye. The name is hyphema. Hyphema. You must call ophthalmologist for this one. This is an inflammation inside the eye, very severe anterior chamber. We call hypopion. So you must call ophthalmologist also. This one you don't have to call ophthalmologist. You don't even have to see doctor. This is called subconjunctival hemorrhage. 1 red spot, but patient eye, no complaints, no change visual acuity. Rest of the eye looks very, very good. No problem. Remember, patient has no symptom, 0 symptom. This is acute angle glaucoma, severe erythema, but also has cloudy cornea, because we review fluid is blocked, no more. It's blocked here, so it builds up pressure. Pressure builds, more and more pressure. And then this is iritis, inflammation of eye, or uveitis. And this is, I'll show you one more picture, but this is opposite. This is here. Whole cornea. Here you will see, this is old picture, but simple picture. Shows uveitis means iris and this together, choroid body, is inflamed. Many diseases does this. Autoimmune disease, sarcoidosis, tuberculosis, toxoplasmosis infection, many things can do this. Okay, so 2 summary slides, then we're finished. So you must know this, because if you are an emergency room doctor, GP, or even specialist, you must know when red eye is emergency, when red eye is something simple. So we did not do all of these, but I will give review. Subconjunctival hemorrhage does not need eye doctor. Simple conjunctivitis, viral, allergic, even bacterial, if you give antibiotic, does not need urgent referral. Corneal abrasion does not. One thing is important. Contact lens. If patient has a contact lens in the eye and has red eye, I think it's a good idea to send to ophthalmologist, because maybe just irritation, maybe some of you have contact lens, maybe just irritation, but there's increased risk of bacterial infection and fungal infection. So patient should take out contact lens 24, 48 hours, wear glasses, and see eye doctor. And then this is more important. This is the emergency you must know. So we showed picture of every one. Acute glaucoma, hyphema, this is blood, hypopion, the pus, iritis, inflammation, and if either bacteria or virus infection in the front of the eye. Okay, so I will finish there. Can we have lights, please? So remember, you can look up whole list. Red eye is, you must have a history and physical exam. History is important. Do you have eye pain? Do you have visual acuity problems? Do you have photophobia? Please tell me, what were you doing when eye pain developed? Do you have rheumatologic review systems? All of these are important. Question. You do history exam like this, and then you also do physical exam. Physical exam is recognition of all these problems that can cause red eye. So we will finish, it's 8:20, we will finish a little early. If anyone has question, please let me know. Yes, go. Yes.
Question. Thank you for your lecture. What's the most common cause of hyphema?
Hyphema.
Hypopion and hyphema.
Yeah, hypopion is inflammation, no? So most common cause, mild hypopion means mild inflammation inside front of the eye, is autoimmune condition, maybe iritis. If it's severe, then usually infection that has entered the eye. Most common actually is post-surgery. Ophthalmologist does surgery and then secondary complication, but also endocarditis. Hyphema is blood inside the front of the eye. That usually is some trauma. Retinal trauma, iris trauma. This causes blood inside the eye.
Thanks.
This is a good question, yes, very good. Okay. Another question. Okay, very good. We will finish a little bit early, then we'll do case conference. We saw 10 o'clock case conference?
10 o'clock, yeah.
10 o'clock. Okay, 10 o'clock case conference. We will see you. Thank you.